For 2 years, Nick Dyball kept a secret from his family.
Trapped. It's probably the first word that comes to mind. Like something was weighing me down.
Finally, at just 9 years old, he told his parents he was transgender.
I just believed him. I'd always been waiting for him to say something. And the other thing which I remember very clearly was, it was like there was this palpable weight that just lifted off him. He was just dancing around after that.
The first port of call after coming out is usually a GP. But finding one in Canberra willing to treat transgender patients isn't easy. A handful of doctors passionate about this area of medicine do the bulk of the work. Dr. Clara Meng is one of them.
Actually, officially, I've actually closed my books.
That's so her patients don't wait more than a month for an appointment.
Demand's increasing every year. I think and we're probably seeing a year-on-year increase in demand of 20 to 30, 40%.
Dr. Su says less experienced colleagues are often hesitant to treat transgender patients.
I think the attitude and approach is really the most important part of it, and the rest can actually follow.
For young transgender people, puberty blockers can be the first step towards gender affirmation. The problem in the ACT is there's only one paediatric endocrinologist who can administer them. Nick first started seeing him when he was 10. Back then, Nick says he was one of fewer than 10 trans patients.
We would sit and chat, we'd talk about my life, we'd catch up, and then we'd get all the gritty stuff out of the way.
As demand grew, the level of care Nick received changed. He would wait hours for his appointment to be seen for just a matter of minutes.
I felt quite disregarded.
Today, trans kids are struggling just to get an appointment.
I'm told they're actually having to wait for a year for an appointment. And for a child who's actually going through puberty, where physical changes are actually happening very quickly, a year makes a big difference.
Meet Jenni Shoring.
I'm a 42-year-old proud trans woman here in Canberra.
Jenni started hormone treatment to change her gender on her 40th birthday. Transitioning saved her life.
The dark days are well and truly gone. I really see the world in colour as opposed to seeing it in, grey or black and white.
Jenni turned to a gender agenda, a community organisation that supports the intersex, trans and gender diverse community.
I think without that we would be really struggling, as a community around, healthcare and the voices that we need to have.
Jenni now works for the organisation and every day sees how Canberra's health system is failing young trans people.
We're talking months and months to see a psychologist that can deal with youth.
And that's in the private sector. In the ACT's public system, there isn't a single paediatric psychiatrist available to treat under 18s.
I think every child psychiatrist has closed books in Canberra, so if you do want that treatment, you have to go outside of Canberra.
ACT Health has acknowledged the impact these failings are having on Canberra's transgender community. It's designing a new model of care aimed at improving access and better addressing the needs of patients and their families. But what advocates want is a hub that connects all the necessary services.
Well, I think it'd be huge. I think that it gives people a clear pathway in.
It would require significant investment from the government and will take time to set up.
If we are to live up to our moniker of capital equality, I think the ACT government actually needs to do more now.
The health and happiness of Canberra's trans community depends on it. Rosie King, ABC News, Canberra.